Good evening. My name's Christina. I'm a resident at University Hospitals in Cleveland, and thank you for this opportunity to present. I have no disclosures. These are the disclosures of our group. All right. Achalasia, as we all know, is predominantly an idiopathic esophageal motility disorder. However, little is known about the efficacy of POEM in patients with longstanding achalasia. Our hypothesis was that patients with longstanding achalasia would be more recalcitrant to POEM than other patients that had symptoms for shorter duration. We conducted a retrospective analysis at a single academic tertiary care center between 2012 and 2022. All POEMs were done by a single surgeon at our single institution. Patients in our study were grouped into 4 cohorts based on symptom duration for less than 1 year, between 1 to 3 years, 4 to 10 years, and then greater than 10 years. Patients were included if they had a documented diagnosis of achalasia and received a POEM at our institution. They were excluded if they were missing any data on their diagnosis, their time frame of duration of symptoms, missing pre-op or post-operative symptoms, or Eckert scores. POEM duration was defined as need for repeat endoscopic intervention, symptom recurrence, and a high post-operative Eckert score that we defined as greater than 3. We performed univariate and multivariate logistical regressions to analyze both our demographic and clinical data pre- and post-operatively. This is our patient demographic data. As you can see, there was a pretty even spread between all 4 cohorts. Patient age, sex, BMI, patient comorbidities, including patients that had connective tissue diseases, diabetes with end organ damage. None of them had any significant differences. As you can see here, the preoperative symptoms, patients that had symptoms for greater than 10 years had more prior endoscopic interventions as well as dilations, but otherwise there were no differences between cohorts. Post-operatively, there were no significant differences between post-POEM Eckert scores, dysphagia, regurgitation, chest pain, weight loss, and our same thing. And our multivariable logistical regression also did not show that time of symptom duration had an impact on POEM failure. I'm happy to take any questions.